because we haven't actually gathered in a long time, and I feel like I know I might need a little reminder about how we gather in spaces together. So I'll read these ones over here, and then if we could get volunteers to read 7, 8, 9, and 10. So 4 volunteers, think about who you want to be. 7, 8, 9, 10 for those of you who can see it. But so group agreements. Number 1, we value being a community of care. Reach in and reach out. Number 2, be in the growth zone. I'll teach and I'll learn. Number 3, challenge oppression and racism. Number 4, intent does not always equal impact. That's always a great group agreement. Number 5, replace judgment with wonder. Number 6, be aware of how much you are speaking. Does anybody want to read number 7 in the room? Anybody in the room who wants to read number 7? Taylor.
Yeah, I'd love to. Create space for others.
Yes, thank you, Taylor. Number 8, anybody? Karen.
Check for understanding.
Check for understanding. Thank you very much. Number 9, anybody?
Number 9.
Don't all jump at once.
Speak your truth and be aware of the ways you hold privilege.
Right on. Claire, do you want to read number 10?
Sure. Strive for suicide safer messaging and language.
Right. How we talk about this work really matters, and how we model talking about this work really matters. So people are listening to us, they are learning how we talk about this work, and they are modeling that in their own communities and in their conversations. So how we talk about it actually matters. All right. Thanks, Jen, for the nudge around staying on track. Okay. So I think I started to say that I have had the pleasure and privilege of visiting most, if not most, I think I didn't go to one committee, but I have gone to most of the committees to see, just to visit, to see what the committees have been up to. I wasn't able to go to any of the advisory groups, but my purpose of going wasn't to lurk and make people feel nervous, but was just to literally see what's happening in these amazing groups and to see what I could be doing to be of support. And I was so impressed, and I don't mean to sound cheesy, but I was just so impressed about the amazing work that's happening in these committees. I mean, it is truly where the magic happens, folks. There is amazing, amazing work happening. There are rich conversations happening. There are literally life-changing things that are happening in these committees and advisory groups. So I'm really, really excited to hear from our committee chairs around what's happening in all of these advisory groups and committees. So schools, is Justin?
Claire is actually.
Claire, okay. So we're gonna have schools.
Come on up.
You gotta be a close talker. You gotta be right up here.
Come on.
Right here, right there.
So Claire is co-chair, right? Or chair? Co-chair of our
Yes.
schools committee. And she's gonna report out on all the things. So be listening, folks, around kind of all the magic that's happening in Claire's group. No, for sure, Claire. And where you might want to get involved.
Don't know you?
Okay.
Hello, good morning. I'm Claire, I use she, her pronoun. And I'm co-chair with Justin, who is online. Justin is school psychologist with Eugene 4J School District and has been a member of the schools committee for many years. I have been co-chair with him for just a year now. So our main priorities are sustaining positive engagement. So we have quite a few members, I think, of the committees, the most members and the most members that have been with us for many years. And our whole role is to monitor and provide guidance for YSIPP, which means how are we monitoring it? How are we evaluating the supporting infrastructure? We have many members from our state agencies, but also folks in schools and in school districts and ESCs. And so we want to make sure that every member's experience and how they're implementing YSIPP in their roles is contributing and guiding to our committee work. And so one of the key accomplishments, and this is kind of a tribute to Lon, who was doing a lot of this work before he resigned from chair, but where does everybody fit into the puzzle within the committee, within the alliance? And so taking a look at, again, so we have ODE, we have OHA, we have our student safety and prevention system, and then we have folks with lived experience in their communities doing suicide prevention work in schools. So what is everybody's role? How are we making sure that we're elevating everybody's voices and experiences, and making sure that we're using our committee time wisely? So meeting once a month having some small group time, having some other opportunities to connect with one another. So just making sure that we know and value everybody's time. Next slide. So then the next key accomplishment is just expanding how we're monitoring school suicide prevention. So in the first years when Addie's Act passed in 2019, a lot of the work was getting messaging out. What does the law say? Making sure school districts are aware. For those who don't know, it requires every school district in Oregon to have a school suicide prevention intervention post-vention plan. There are 197 school districts in Oregon. So that was largely the work of, do school districts know what they are expected to be doing? What is the support system? However, we have been learning that to monitor that has been, mixed methods, I suppose. So in the last year, we've had many presentations, which, so we have maybe 2 or 3 presentations per meeting. So many big river programs, so that's QPR, Youth Save, Assist, Sources of Strength. And then we also want to hear from our local projects, such as Forward Projects here in Deschutes County doing school suicide prevention. We want to hear from the support system, so that's our Lions to Life School Suicide Prevention and Wellness team, the SSPS team, and all the ESDs. And then, of course, we have U of O Suicide Prevention Lab. And then student success plans that are coming out, and this is more recent. How do those plans connect to Addie's Act? There's a lot of similarities in how schools are getting support there. Major accomplishment tied to all this is just realizing the lessons learned that monitoring Addie's Act has needed to be separated from policy requirements. So that's a posted plan to what is it actually looking like implemented in schools. And so that will be part of us are looking forward as how are we monitoring that? How are we monitoring what does a successful suicide prevention plan look like? This last spring, we had quite a few members engage in testimonials, going to state capitol to report out. So the 2 highlighted ones here are HB 2656. So several members, we all testified in advocating for the student health survey, which passed, so that is exciting. That will be something that the school committee will be super interested in seeing how it's implemented, how is the data going to be reported out, how can that guide how we are monitoring Addie's Act and other suicide prevention initiatives. And then House Bill 2643 was there was a similar bill requiring individualized student suicide prevention plans, which honestly would have caused a lot of confusion as that relates to Addie's Act and what schools and school districts are required to be doing. And so honestly, it was just really exciting to have so many different members. We had folks in school districts coming and speaking with us, providing written testimonials, and we had a lot of really, really good conversations in our committees in our monthly meetings. So looking forward, and this is a huge shout out to Justin Potts, who is working so hard on a report that's going to summarize a lot of the things I just mentioned, but more in depth. And that report will be shared with everybody within the Alliance. And that's going to give, again, highlight what have we been working on, but as well as recommendations. So a big part of the committee is we want to provide recommendations. We want to advise on what needs to be happening moving forward, how we can have some more support to be monitoring. Improving visibility of district suicide prevention plans in schools. So that is how is the district plan getting down to schools. Being clear on our intentions, clear direction on how we are monitoring. How are we reaching students? A lot of conversation about how we can get more youth engagement, youth voice. So keeping an eye on different ways we can do that. So if anybody has ideas, we're constantly welcoming that. Again, interest in the student health survey. And then wanting to hear more from schools and districts. So what is actually happening on the ground? We have many members who are in school districts, but we want to expand that where they are in the state, how does that look different from someone in Eastern Oregon than it does in like Salem and Portland? So really wanting to have some more voices to speak to that.
Thank you.
I'm gonna pause for a minute and make sure Justin does not have anything else shared here.
Justin,
Thank you, Claire. I just appreciate you so much for taking the heat and being the first up on this one. And I think you captured everything there. I wish I could be there in person, and was hoping to have this report ready for you, but by this conference. But as you know, in the schools, it can be a crazy start to the school year each year. There's a lot of things happening out there, so appreciate you all being there, and wish I could be there with you. Thanks.
Anybody have any questions in the room or online? Comments for what Claire shared about schools?
Laura Rose, I say that's a lot of work, and thank you for that. It's great to see such attention being paid where it needs to be.
Thanks, Laura Rose. Yeah, I would echo that. I also heard really clearly from Claire that they really are looking for folks who are in the schools doing, or who are actually physically in schools doing work in the school system, specifically maybe like Eastern Oregon or Central Oregon. So for folks who are kind of thinking about ways to get involved, for folks who are school affiliated, consider joining the schools committee. All right, thank you, Claire, very much. And Justin, who's not in the room, but thank you very much. So next up is our workforce committee, and Julie Schultz is in the virtual room. And she is going to be sharing out what is going on with the workforce committee. Julie is the chair, co-chair, along with Don Erickson, and they're doing amazing work. So Julie, are you with us?
I will double check. I don't see her name.
Okay.
And Dawn won't be here till 10.
Okay.
So neither one of them.
Okay. All right. Data and eval will be our next committee. And that's me. Karen, that's you or Taylor? Taylor.
I'm just pumping her.
Okay, Karen, that's you.
Thank you.
Okay, Karen is Karen is chairing that committee, and she's gonna come and give us. You gotta be close to your seat. You gotta be close to her.
Stand here, can you hear me and see me? I'm wondering if you pin the speaker, we can maybe see better when people speak. The speaker view?
Maybe people were just wanting to see it. Everybody who was like more people who were in the room just to know who was present. So that's why I had that.
And people who are online, you could even, if you want to, pin the Alliance staff screen, because then you can see, because we're really small. Anyway, we're gonna see. So Sandy Bumpus and I are the new co-chairs of the Data and Evaluation Committee. And so some of this report is more looking forward than looking backwards, although I've been on the committee. Sandy, I've been on the committee for a number of years. And in the past year, we've done a lot of having people come in and talk to us and share data with us about what we have. And so we have, like, within our committee, we have a huge sort of picture of what data is available. And we also, our committee members, a lot of them are people who are doing research around suicide prevention and evaluation. And we also have people with lived experience who are helping us to understand and interpret that information. And we really welcome more members, especially people who have lived experience or want to know more about data and evaluation. And our goal is to be a support to other people who are not necessarily immersed in data and evaluation, and to make it more understandable for others. So in the past year, we actually have developed like a list of key focus areas. So these are the focus areas that we came up with. And of course, one is increasing access and use of suicide data. And then also staying up to date. That's why we get a lot of people coming in and giving us, talks about what's going on. And one of the, our purpose, which we want to talk to all of you more about, is that we can provide technical assistance to the other committees and affinity groups. So if you, want some technical assistance from a single member, you want us to come into one of your meetings, you just want to bounce things off of us, that's our purpose, that's why we're here. We can also like tell you other data sources. For example, we actually know, we have quite a lot of information about what's going on with schools and research that's happening within school-based organizations that we can share with you if you'd like. And then we have a sort of a subgroup within our group that's working on a data equity framework, and we do not want to recreate the wheel. And so this coming year, we're going to be sort of looking at what's already been done and what's available, and looking at it for the data perspective to make sure that data is presented in a way that that promotes equity and understanding. And then we also want to review things from a data and evaluation perspective and provide support and feedback to OHA and the Alliance on the other work that they do. So those are our focus areas. And then last week we met and sort of finalized our work plan for the coming year related to those focus areas. And we've also sort of added a little bit more to our standing agenda so that we have links on our agenda to data sources such as the OHA's violent death data dashboard and that sort of thing. So anytime that we're working on something, we can just click on those links and go to them. And then we were also asked to review the 2022 YSIPP report from a data and evaluation perspective. So we did that. We just finished that, and we posted some of our recommendations here. And we also have a recommendation for the Alliance in general, for your committees, that for future reports that you might also want to review, maybe a draft of the next YSIPP report that comes out from the perspective of your committee, to see if you have any recommendations, either ongoing for future YSIPP activities, as well as just and also thinking about like equity things, like how things are presented, and make sure that they're presented in a way that resonates with the work of your committee. So next. So that's our work plan. I sort of talked a little bit about what we're doing. One thing that we've decided to do is, because we have a lot of information about what's ongoing research and data that's available, we have this spreadsheet that we've developed for our own internal use. And so in the coming year, we're actually thinking of expanding it to also include lists of other resources, and then working with the Alliance to make it something that is potentially something that's searchable, that we can put on the Alliance website. So anytime that your committees are working on things and you're interested in knowing what information is out there related to what you're doing, you can just go to it, and we will maintain it and keep it updated as a resource for everybody. And then, as I said, we're inviting broader representation on our committee. We love everybody. And we really appreciate the knowledge, especially that people from specific subject areas, or people with lived experience, can bring to our work. And then these are the types of technical assistance that we've thought of that we can provide to the Alliance. So making our resource worksheet available on the webpage. And then looking at future mini grants to make sure that there's data and evaluation components to mini grants that are awarded. And any committee that would like a liaison from our committee, you can just ask us. I think there are some people on our committee who are already in other committees, but if you don't have a data and evaluation person in your committee, you can go ahead and contact us and we will see if somebody is available to come and join your committee. And then we will have a standing agenda so that if somebody comes and requests wants to come and talk to our full committee and get any kind of advice or feedback, that we have a placeholder in future meetings. So again, you can contact me or Sandy or Jen to make that request. And I think there is a request already out there. And our last meeting, we wanted to do this work. And so if that request is still there, we can actually cover it in our next meeting. And then also, we just want to know if there's any other types of technical assistance or any other way that we can support the work of the Alliance. And so you guys can talk about it amongst yourselves or let us know now if you want. All right.
So I don't know if it was clear, folks, but the Data and Evaluation Committee would really like to support us all. I don't know if that came across and what I was trying to say. Yeah, it wasn't clear. That committee really wants to support the work of the Alliance specifically. I don't know if you got that, but that was really clear. Okay, yeah. So, and I know one of the things in visiting the committee just recently, I am a social worker. I went into social work to avoid numbers. Like literally, I am very fearful of numbers. The one statistic class that I had to take, I like barely passed. And it introduced me to anxiety in a way that I had never experienced. And so I offer that to say that you don't have to be familiar with numbers. You can be scared of numbers. You can have no knowledge of like research or evaluation or anything and still be a part of the Data and Evaluation Committee. I think for me, a long time ago, I thought, well, I can't be a part of that group because I can't even help my kid with like, her math and whatever. It's like, I don't do math. And but in talking with them, I mean, they are really able to help in ways that I think in my head have previously been unimaginable. So think large, think big around how, because a lot of the work that we do, folks, we want it to be measurable. We want to be able to say we made a difference, and here's how we made a difference. Use the data and evaluation team to help you come up with those measurable goals. And then once things get implemented, measure the implementation. Is it working? Is what you want to have done, is it working? So use that.
Yeah, I actually want to just follow up on that, saying that that's sort of our goal, is to help the people that do the hard work. Like we all do, especially like frontline workers, people working in Boston, you all do the hard work. So our goal is to support you in that. And if as part of your committee, you want to do a survey or something, that you can come to us and we can help you fill out the survey. You don't have to do it on your own, but what we do is we really like to collaborate, because we are not necessarily the subject matter experts, right? You are all the subject matter experts. And so between all of us, we can come up with some really good, interesting stuff. And our goal is to have data and information that is useful and will be used, because we don't believe in make work for the sake of driving numbers. And so the point is really to have it be something that's useful. And we also don't want you to miss any information because you're not quite sure how to get it.
So if folks couldn't hear, Karen was just saying that the goal is to really be able to help the other committees. And if there's like a chance for you would like a survey to be created, you'd like their support around that the data and eval is here. It's really, the point is to have data that's helpful. That way people on the front lines actually doing the work can help use it to influence their work. So it's stuff that we want to be useful, not just data to have data to be like, oh, here's a number that's pretty, but actually to be able to do something with it.
Awesome.
She said it much better than I did, but that's just super brief summary, but she said.
All right, folks, any questions or comments for data and evaluation before we move on? All right. Do you wanna do one more? Do you wanna do transitions of care?
Let's do transition.
All right.
Here, then we'll jump back. I'm having COVID.
Okay.
Julie's here.
Oh, Julie's here, wonderful.
Julie's in the
Okay.
room, yeah.
Charlotte Lumby wears many hats, and one of the hats she wears is, continuing to spearhead Transitions of Care Committee despite being the co-chair of the Alliance. So you have to be a close talker, get in there.
Oh, I'll get in here. Good morning, everyone. How many of you have been here the whole week? Yeah, so lots of transitions, perfect for the topic. I am the co-chair of the Transitions of Care Committee, which really originated with House Bill 3090 and looking at what those transitions of care should look like as someone is leaving services for behavioral health, mental health, emergency visits, that type of stuff. So when I originally stepped into this role, that had really been the focus of Transitions of Care, and I had a leadership team. And I stepped in, and that was after the committee had been on break for a year. So kind of came into this role and, okay, this is where we've been. And what does that still look like? Had a co-chair who had to step aside due to professional needs. And so was in the midst of really trying to build structure and leadership for this group and kind of define what it looked like to move forward. And so I have Liz from the
Oregon Youth Authority.
Thank you, Oregon Youth Authority, brain fart, have those often, and Jen is always there to help me. As you can tell, she wears a million hats above and beyond all of us, so we're always thankful for her help. Who showed up meeting after meeting after meeting and really stepped in to this commitment strongly. And so it's been really nice to have someone come up and do this work together with all of our active committee members. So that being said, this huge focus was on 3090 for all of this time, and what did that look like? And it was passed, and then along the way, other things happened, like emergency survey with OHA, and the original response wasn't huge, and they went out and they redid it. And when they redid it, we had an impressive 100% response. So coming from someone, of those of you who don't know my background, I've worked as a nurse for 17 years, and understanding the medical system, I would say that that's nearly impossible. So that was a huge feat to really get that. And that survey was looking at, what does it look like for these emergency rooms? Are they implementing, are they holding that structure of 3090? And so really what that meant for Transitions of Care is now we're in this space where we're monitoring what's happening with that. What does that look like? And that's what we've always been circled around. And so then we started transitioning ourselves and saying, what does this look like moving forward? We want our work to be actionable, purposeful. We want to make sure that we're making impact at the ground level and making sure that what we're doing is actively, intentionally working to continue to decrease youth suicide. And so we've spent some time really trying to gain committee members, understand what it is for those committee members, where are their specialty, what would they like to see happen in this space. One of the things that we can really easily do sometimes is start something and just spearhead it and say, okay, we're moving forward. But let's lean into the people that are doing this work. Let's lean into the people that are volunteering, putting their time forward, and see what they think that they can bring to the table to make a difference. And so we spent a lot of time doing that. The new YSIPP was released, spent some time digging through that. And now we've come to a place where we've said, we know transition is happening everywhere. It happens across the board. You transition as you walk out this door to go get coffee all the way on the other side of the room, right? And then you have to transition to find your way all the way back. And so what does that look like? Where can we make the greatest impact? And how can we do it in a way, again, that's purposeful? So we have come together as a leadership team, myself, Liz, Annette, and Jen have sat down and spoken and said, yes, we're going to continue monitoring the original goal of this group. And we want to move forward with strong purpose. And so in order to do that, we've had committee members who have done great things like bringing, I don't even know where I'm at on there, so I'm just blabbing. So
You're
you can
good,
move
you're
the
good.
slides. We have had committee members that have said, hey, this is where we see something. Let's bring in presentations. Let's do this. Let's talk about our strengths. And now we're going to be taking all of that and we're actually going to be doing strategic planning as a leadership committee in line with the YSIPP, which is our guide, right? What are we doing? How are we doing it? Where do we need to be? And we're going to take that and we're going to move forward with transitions of care in a way that is tangible, in a way that's in line with the YSIPP, in a way that we can continue to make that impact and meet the needs of those out there. So we encourage you as a committee, if you have ideas of what that looks like, because again, transitions takes place everywhere. It doesn't just take place from an emergency department. I am a mom of a daughter who struggled with significant mental health after open heart surgery. A mom of a daughter who then after that struggled with substance use. I can't even tell you how many different places my daughter was and how many different places these transitions take place. And if they don't take place well, it has a significant impact on that individual's outcome. And so from our standpoint, as we get ready to go into strategic planning, we want to take everything we've learned from our committee members, everything that we have sitting there from the YSIPP. And again, I would encourage you, if you have ideas of where we can be making that direct impact, please reach out, bring your ideas forward. It takes a community to do this work. As we can see here, we don't stand alone by ourselves. All of our ideas are meaningful. So our goal moving forward again will be to start taking a couple of those tangible ideas, moving them forward and continuing to reevaluate when we have completed that work and we're in evaluation mode and move forward with the next steps, because we know that those transitions don't end. They're always somewhere. I don't think I followed that at all.
But you
should
hit all
we
the
get to
points.
this?
You hit all the points.
And, yeah, okay. Does anyone have questions? Giggles, I appreciate giggles. That means I get to laugh too.
Crowd goes wild.
I have an idea, like I just think about like Claire's in the room and Justin's in the virtual room, and I just think about, like, at least in Clackamas County, and I'm sure many of you see this as well, wherever you are in the state, that the transition of young people going to the emergency room and then showing up at school on Monday, when they have not been admitted. And then it happens, this thing happens where there's like how was your weekend? Oh, well, I went to the emergency room because I was having thoughts of suicide. It's just like a blink and then they're gone, the student is gone. And the school is like, what? And so I know for me in Clackamas County, I would love to figure out a way, and we were really close. We had an agreement with all of the schools and our local emergency room to be in contact around the social workers in the emergency room agreed. We had a list of these people that could come, and due to capacity issues, this is pre-COVID, it just didn't happen. So there is willingness, like both sides recognize they want to have that done, but I would love to figure out a way to really make that transition out of emergency departments for our young people. And how can schools be that soft landing for kids, knowing that schools are not a mental health facility, but we know that our schools are where young people spend the majority of their time. So you have a question back here too.
Yeah, this committee is really intriguing to me because in Columbia County, we don't have a hospital. And so we're finding that their kiddos are coming back and no one even knew they went. And so as a mental health agency, we're trying to reach out to the schools, and like you said, it's like, oh yeah, they say something and then they disappear and there's no follow-up, there's no post anything for them. And so I'm really intrigued to, I work.
So it
with
sounds like you'll be
committee to
joining the
figure
schools
out
committee or the transitions of care committee.
Yeah.
And
Schools
And we have these great ideas coming to our room all the time, really centered around actually just that. What does that transition look like from hospitals to schools? And there's lots of missing pieces there. It's not just from hospitals to schools. It's also from if your child has spent time in some type of facility. So I'll use an example, a personal example. My daughter spent time in Unity much longer than your standard stay. Actually, she was there for multiple weeks. And what happens in those settings is they end up getting discharged from the school system even. And so they no longer even have access to their education. And then the places that they're in don't have access to provide education because it's not on their plate. And so you all are bringing up exactly those exact things that we need to be thinking about. This is so much more, and those transitions take place in so many different settings. And Galli makes 100% point there that our children spend a mass majority of their time in schools. I say that all the time. I have the honor to teach transportation staff on recognizing suicide, right? Those are the people that see our youth at the end of the day after they've had a hard day at school. Our kids spend more time in schools than they do with their parents. So yes, how do we make those connections? How do we make connections in communities that don't have hospitals, right? What does that look like? So yes, please, I would encourage you, if you have things to bring forward, if you would like to join the committee, if you would like to just jump in, you don't have to be there every time. Bring your voice forward, bring your ideas there. That's how we make this work happen. Absolutely.
Jen, you had your hand raised.
Charlotte touched on it because she's smart, but I was just gonna bring up how also too kind of not just the school to hospital, but the hospital to school, but then the reverse too. Mary Massey, who sits on transitions of care and schools, brought that up as an issue in her district that we've talked about quite a bit. And she brought up the same thing, how just like her parents though, if Mary, I believe you're on, so if I say anything incorrectly, please let me know. But from what I remember, her parents are told too, or even like the school is told that the school will be the ones to continue the education while they're in there, but yet when they're gone from the district for X amount of days, they're discharged. So that's not the case. So then there's just all this messaging that's going around that's not correct, that people are expecting something to be provided and it's not. And so something that Transitions of Care has been thinking about is like, who exactly do we go to ask those questions? Like, what's the point of contact within these different entities that we can find out what the heck people are being told, like what the actual process and protocols are, what the cert, so that's something that we've also bounced around to, and we're in the process of writing a letter to kind of figure some of that out. We don't know who to send it to. So
Yeah.
once we have it written, then the next task will be like who to send it to. But yeah, so that's something else that and Mary's raised her hand.
Yeah, and our problem with our smaller district.
Hold on just a second, Mary, we can't, we're messing with, no, it's not you, it's us.
Okay.
Oh yeah, I'm gonna check some, can you
hear me now?
While they're getting that figured out, what I would like to also say in regards to some of these transitions that we're talking about around schools is if we have the professionals that are handling this care and working around this care, not that we're not always including families, please do, families at the ground level. But if we have them having some form of communication and assisting with that transition, it takes an immense amount of pressure off the parents too. Because historically, parents are the ones that are all of a sudden responsible to like try to deal with school systems and deal with all these different places when their children are struggling. And not always received well.
Yep.
Okay, so it does help to have professionals in that realm, which can really have a voice and speak up as well for the whole family. Is Mary available?
Yes, I think we fixed the thingy. Mary, would you like to try again?
Sure. Can you hear me?
Yep, perfect. Thank you.
Hi, Mary.
Hey, hi, everybody. Yeah, the problem we had from a smaller district is we don't have an online option. So a lot of the larger districts can accommodate kids that say go into Unity or inpatient somewhere. But smaller districts like mine and other districts around the state that don't have that ability, and it's hard for Unity, right? Because they have students coming from Portland that can accommodate, or Beaverton or Hillsborough, but then kids from smaller towns that they can accommodate, they just maybe assume it's happening. So we have, parents in high crisis state that now are told one thing, but the school can't follow through. And I think at one of our, is either schools or transition of care meeting, we did have ODE there and we brought it up. But I don't know if they're part of the solution to this or not. So
Yeah, Mary, Noel from he is in the room here and he's nodding his head.
for a meeting, isn't it?
I'd be happy to join and discuss that. It is a challenge. Like, just say, there's not like a one size fits all solution to that. And that doesn't mean that we're not willing to, of course, be at the table and try to design, and complement and ways to come up to support those efforts.
So Mary, Noel said he's gonna fix it.
Woo!
And there is, I know that we have to move, but there is one more hand raised from Justin.
Thank you so much for talking about this. Obviously, I don't have to remind those of you in the room that this was Jerry Gabay's work for quite some time and kind of that unfinished business. There are things obviously outside of what happens in legislation, as you talked about, that are, misinformation that's shared. But I think the focus really continues to have to be on what were the barriers to passing this legislation in the last couple of rounds. What are the elements that are really causing sort of that pushback against this sharing of information between schools and health providers in the interests of students during these critical, moments? Everything from on ODE side, like the 10-day drop rules that bring kids out of our system, make it harder to reintegrate them after they've gone to any sort of acute care. As well as the ability to not use the parent, as you said, who is already in crisis, as the transporter of information between medical providers and schools, so that we can have a more direct communication about that standard of care and care planning as students leave, come and go from their school. We know that was as came up at the very beginning. That belongingness, the sort of triad of things related to suicide, that connection with community is the one thing I think I see most frequently as being disrupted in this process. And there are fixes, and I think it's going to require everybody on deck to advocate when legislation comes up again. So thank you.
Thank you, Justin.
Thank you so much, Justin. So thank you everyone for listening. Thank you for your amazing questions, your ideas, your thoughts. Yes, please step in, please join, even if it's just like, hey, I want to drop in one time. We'll be bringing our strategic planning ideas forward in our October meeting for our group. And if you're interested in when that is, hit Jen up. I don't have it in front of me and she answers all. So thank you so much.
Thank you, Charlotte. Thank you very much. And so folks, these are the conversations, like this is that, feel that energy in that room, or like, oh, this is a good idea. And like, if we leverage each other's knowledge and like, our partners, and it's like, this is how the work happens. This is how change happens in the state. So thank you, Charlotte, and Transitions of Care. All right, next up is our workforce committee. And I understand that Julie Schultz is in the virtual room.
Yeah.
Julie, welcome. Julie Schultz is the co-chair of the workforce committee, and they are doing amazing work as well. All yours, Julie.
Thanks, Callie. Hey, everybody. Just want to acknowledge those of us who are in the room and those of us who are joining this meeting, many of us at 9:30 this morning. I wouldn't mind just for those of us virtually to understand who is in the room. It's a little hard to see in the little square on my computer. Callie, can you kind of just give a quick, like what kind of numbers, who all's there?
I'm laughing. So there are probably about, Jill's counting, maybe 30 of us, 25 of us in the room, a handful of new faces, which is amazing. And a handful of old timers who've been around for a while.
Count me as an old timer. That's great.
Also amazing, yes. So we're speaking to some folks who don't know anything about workforce committee, and you're speaking to folks who probably need a little bit of a reminder, maybe. So how's that?
Okay, that's great. Well, welcome everybody. Great to have all of us being able to meet in this hybrid environment, and I hope things are going well in Bend. Yes, along with Dawn Erickson, we are the co-chairs of the Alliance's Workforce Committee, and I'll be quick here. Happy to take any questions separately or through the chat or through email, and I'll put my email in the chat later. Well, what have we been doing? We've been in 2021, here's the thing for those of us in the Alliance and new to the Alliance, there tend to be a lot of numbers floated around that those of us who've been in the trenches for a while, even us, start forgetting what they are. So I'm just gonna say that House Bill 2315, which you might or might not remember what that is, was a bill in 2021 that passed, that the Workforce Committee was the driving force for. And this is a bill that required the behavioral health workforce, behavioral health experts, the people that we refer to get continuing education on suicide risk assessment, treatment, and management. And it was a bipartisan bill. When we spoke to legislators about this bill from all parties, we found that it didn't take too long in these meetings for us to hear, literally, I think, from every single person that we talked to in the legislature, a personal experience with suicide, whether it had been a family member, the best friend of their son in high school, you name it. So there was a lot of support for this idea that, we want to support our behavioral health workforce in getting training. That bill basically said 2 hours every 2 years or 3 hours every 3 years. It sort of depended on the licensing boards. And now we really want to know, how's that working? What's most effective? We have great people on our workforce committee. We welcome any others, people who are interested in research, people, in the implementation of policy, as well as, supporting the YSIPP. So that's a key focus area. The other one is that there is a new project that Annette Marcus and others are putting forward, the Small Steps Project. I think you probably have either read or heard about it. It's a campaign to engage community businesses and organizations in suicide prevention in the workplace. So reaching out, we have a committee member in Curry County, and I don't know if they are here. But Gordon, if you are, shout out to you. And anyway, Gordon's been doing a lot of great work in Curry County with going into businesses, bars, restaurants, you name it, and giving them materials on helping their customers and their workers reach out in times of need. So that's a project that's going on. We're also looking again at whether, what is our focus or what might our approach be if we are wanting to, again, increase training for medical healthcare providers. We had a bill this session, Senate Bill 818, I believe that's the number, again, these numbers, but basically it was supporting, asking for support for OHA to improve the infrastructure of creating and disseminating continuing medical education for medical providers. That bill did not pass. It got passed out of committee and stayed in the Ways and Means Budget Committee, as many bills did this past session. And we, again, continue to promote various suicide prevention trainings with the work that we do. I don't know, do I have another slide? Yeah, I do. Okay, so I would say, when we talk about our accomplishments, this Small Steps project, we're working with AFSP with that. That's something they've been involved with for a while. Again, as we all know, one of the most important partners in the state for this work. We are also supporting, we supported the development of training for traditional healthcare workers. Jill Baker has been heading up a lot of that work. That's something else that we provided input for. Next slide. Key challenges. Yeah, key challenges. The young adult the young adult population. It's often hard to figure out the best ways to reach them. Again, the small steps program is hoping to do some targeting with that. We again want to track the effectiveness of that bill for the continuing education, excuse me, for the behavioral health workforce. Yeah, something that's kind of an ongoing thing is that when we have approached healthcare providers to take suicide prevention training, they have said, yes, we would like support with that. We recognize that is in our wheelhouse, particularly primary care right now, and give us something substantial. I don't want to just be, filling up time to click a box. But by the way, don't tell me what to do. And so that's always a kind of an ongoing challenge and opportunity for our workforce committee and for all of us in the state. And we are looking for a champion from the business sector to help us in our workforce committee. Makes a lot of sense with the work we do. And we've identified that there are a few culturally specific suicide prevention trainings available. So that's something that we're always using that equity lens to try to think through. I'm not sure. Do I have one more slide? I'm trying to remember.
That's it.
Perhaps I think, Jen.
Oh, no,
Yeah.
I lied to you. There's one more. It's
No.
just called schools committee, but it's you.
Oh, okay. Oh, okay.
I missed the slide, sorry. I missed
Awesome.
it.
Yeah, I love it. Okay, so looking forward, again, a lot of this has to do with evaluation. So we so much appreciate our colleagues from the University of Oregon Suicide Prevention Lab, as well as our evaluation group here at the Alliance to help us with these things, to look at effectiveness and efficacy. And I'd say that one of the special things that we've been talking about, we were talking about this summer that we, Gally actually has brought up this issue, and we've discussed as well, is really identifying what training is available for folks, and making it clear where are the best connections for them with the many trainings that we do, that the state does have. Part of the Big River program, if you're in this field, or you're at this level of responsibility or interaction with clients, this is the best training for you. So OHA has put out some great charts that kind of connect the dots. That's something. Also, how to make these trainings affordable for organizations, if that's the case, or to how to promote this with staff in order to be able to take these trainings. And the other thing is that, a lot of this whole work has been about continuing education, which is important, absolutely, right now to enable the workforce to do better. And we'd really like to look at what some folks call pre-service training, which is getting that training about suicide prevention in your master's program, in your medical school, in all your trainings that you might hopefully get at any level of education, higher education. And so that is something that I know at OPS we're providing trainings to incoming residents. At OHSU pediatric residents, to try to get them, right from the beginning of their career, to have that sort of that's training. We've done that also at Portland State, George Fox, other universities, and I think that's really important. That's all I've got for now. Thank y'all.
And I'll just add that, Julie, you don't know this because you're not in the room, but there are folders on your desks. We would have loved to have enough for everybody. We've been having a little challenge with our printers, but we want you to be able to take a look at these. This will become the Small Steps program. There's one for advocates for you, and then there is one that you would actually be handing out to business owners. And essentially what it is a packet of information that is like the OSHA signs that every employer has in their staff room, et cetera. So it will include actually the new OSHA handout that is about mental health and the 988 line. And then it's a series of other resources for people in the workplace. And it's been really exciting that American Foundation for Suicide Prevention has wanted to partner with us. Because if you, as an advocate, and this is an ask from our committee, is we would love any of you who are motivated or friends with folks who are in the business world to make to ask them if they're willing to put these materials out. And if they become interested in more information, then AFSP is willing to bring somebody in to do a presentation with them on Talk Saves Lives, which is very appropriate at the level of kind of the workplace.
Much good.
Thank you. Thank you, Julie, very much for sharing with us what you all are up to in the workforce committee. That's amazing. Again, it always just makes my heart smile in the biggest way to hear about all this amazing work. So does anybody have any questions or comments for Julie and the workforce committee, either online or here in the room in Bend?
You know, Gally, the one thing I would also say about this committee that we didn't say is we have been a small but mighty committee. And we really very much would like to have some more membership for this one. And I will say, as somebody who looks at all the different committees and advisory groups, that many people are drawn to the schools committee. It's got 25, sometimes 30 people who are there. And the workforce committee often has 5 or 6 people in the room. And so if you're somebody who's especially thinking about, I would say our 18 to 24-year-olds who actually have the highest death rate in the population that we are committed to serving, that the workforce committee is a good place for you to come join in our efforts. And we're fun. We have a great time with each other.
All right, are you presenting for the LGBTQ
Yes.
advisory? Okay, we're gonna hear about the LGBTQ advisory group from Annette.
Great. Well, I do not chair the advisory group, but Ren who is one of our co-chairs, is a school counselor and is not able to get out today. Aubrey, who is our other chair, is elsewhere. I don't know why it says Liz Schwartz. We made a slight mistake. So just promoted Liz to the LGBTQ community, but actually it's Ren Fulmer. Our key focus areas are promoting affirming schools, families, and cultures for LGBTQ youth, and equipping allies with tools to fight the really very toxic rhetoric and misinformation that is out there. And next slide. I don't know, is Sisha in the room today? Yeah,
Sisha is.
I want to share first some just brief statistics just about why is it that we have an LGBTQ advisory, why is this work so incredibly important?
You mean you want to read what she's presenting, Gally?
How unreasonable.
So unreasonable.
So LGBTQ youth first, I want to just start with this. LGBTQ youth who have families who live in a community that is accepting, report significantly lower attempts of suicide and despair, other mental health issues than young people, and frankly, older people who are living in communities that are not supporting them. We always want to frame talking about LGBT community from that perspective, because it's not that there's something inherently wrong with us, those of us in the queer community. It's that the circumstances of the world present a lot of challenges. But I also want to emphasize that in the recent survey, more than 88% in Oregon students reported they regularly heard anti-LGBTQ remarks. 61% report being bullied. 43% of transgender students report seriously considering suicide. And this is interesting, LGBTQ students are 3 times more likely to miss school due to fear. And again, this is one of the ways our works connect up from committee to committee. It's going to be really interesting to see with more schools engaged in the health survey. We should really get clear statistics of what that looks like around the state and more ideas about where, you know, where there might be areas for us to provide support. I'm gonna see. It's dry up here, for those of you who aren't here. I don't. About 1 in 4 organized experience conflict at schools based on multiple things, but sexual and gender identity are one of them, as are race, ethnicity, and culture. And really, I would love a future for the Alliance where we had groups that were advisory groups around each of the Student Success Act areas and populations. We're not there yet, but that's a vision to hold out for moving forward. About 8% of Oregon's 6th, 8th, and 11th graders are trans or gender expansive, which is, I think, a significant portion of our population. And about 1/3 of Oregon youth identify with LGBT plus in one way or another. And so that's, I think, not commonly understood. And it really speaks to the importance of this work. Next slide. So just want to acknowledge a few of our key accomplishments. One is that we have partnered with OHA to provide mini grants to LGBTQ organizations across the state. This occurred at the beginning of COVID. I want to acknowledge Chris Bifalco, who was just a really effective leader. And one of the things that has come out of that is actually an ongoing learning and support community. And it's really one of the items that we have most identified is this sense of isolation and of not knowing what, especially for folks who are not in Eugene or Portland. And I say Eugene or Portland and not the counties, because you could be in Lane County and also feel very, very isolated, like if you were in Florence or up the Mackenzie River. So we really are trying to find ways to provide opportunities for connection and community care within our community and with each other, especially for those of us who are wanting to really lead work. We have sent letters advocating for LGBTQ affirming policies to the Oregon Health Authority and Oregon School Board Association. We've done a lot of conferences and would like to continue to do that. And I'll just mention a couple of the places we've done conferences because it's interesting. I think we presented at the Oregon School Board Association. And I don't know if you've been following the news, but there have been a lot of very heated school board meetings. And part of what we're trying to do is equip these school board members with some of the language and skills to counter what have really become very harmful kinds of ways of talking about us and about our young people. Our perspective, we like to say we are from harm reduction to liberation. So that means at the harm reduction level, this is really around engaging families, parents, people who may not, who because of cultural reasons or religious reasons, may have opposition to the LGBTQ community, may be very fearful and scared about their children being engaged with this community. And so we've worked a lot with something called the Family Acceptance Project, which provides some concrete tools for talking across that gap and really talk about the fact that small differences in accepting behavior. It's amazing what the studies show in terms of the long-term impact of that. So you don't have to necessarily take somebody from being angry, upset, scared that their child is queer to running around at a pride parade. But if you can get them to use their preferred gender, if you can work with them to intervene if mean things are happening from other family members, it actually makes a really huge difference in young people's lives. So we are doing family acceptance trainings. We have had a wonderful grant from the Oregon Department of Education to do that work. And most of the work is led by the Family Acceptance Project itself. But we are also working in partnership with the Oregon Family Support Network. And our part of that work is small but mighty. We do a lot of the outreach and connecting to be sure we're getting connected up to the schools. Next slide.
There was a question in the chat about the previous slide with the data. Do we have access to see the race and ethnicity along with the data that was shared?
You know, I am happy to look for race and ethnicity data. What I know is I think we'll do better with national data for that than for Oregon, because some of the data becomes small enough numbers that it's hard for them to collect and report it back. We've also really been developed some key resources, and those of you who are here probably passed the table on the way in. Some of these resources are out on the table. For those of you online, if you click any of these hyperlinks, and of course we'll send out the PowerPoint afterwards, you'll get you these. And I generously say we have developed it, but I really want to acknowledge Sish and Chris and Lake, who have been really instrumental in building out and developing these tools. And we actually have just a brand new one that we brought here today that Sish has led efforts on around affirming students themselves. And it's exciting and impressive, and you know, like a small thing that you can do to be part of this. And if you are queer, to celebrate yourself in your community, if you are if you want to be an ally, get these materials into the hands of your local school. Walk on down, talk to the principal, say, you know, here's some things that you can do to actually make your school place a warm, accepting, supportive environment.
Somebody has, Mila has her hand raised.
Yeah.
Go ahead, Mila.
Sorry, thank you so much. As we're all trying to navigate being in person and online. So thank you so much for those that are calling into the hands in. I guess I'm so grateful for the opportunity to listen to what the other committees are focusing on. And, you know, one thing that I continue to hear is from each of the committee members and the folks that were able to present on them is that they have a strong racial equity lens. I guess what I'm going to continue to bring into conversation, and for those that know me, know exactly what I'm probably going to say, is that what does that actually look like in practice? And I personally, as a person of color and as a person who's part of school buildings and who collects and analyzes data 24/7, I never, in order for me to have my glasses on, my racial equity glasses on all the time when I review this, I never associate data without race and ethnicity. And I really encourage us to do the same for this committee, or for the Alliance, because we really should be thinking through that lens all the time. And when I think about the suicide screenings that we receive at Portland Public School District, yes, we had over 700 suicide screenings last year. And a lot of the impact was from students and students of color and students that identified as Black with that intersectionality and being LGBTQIA+. And that's why I'm centering and really providing that attention for this next school year and assuring that they have access to resources, information, et cetera. And so I really worry that when we talk about data, that it's a global data, yes, without like actually attaching race and ethnicity to really center and really specify who is also needing to be attended to besides one part of the identity.
Thank you for that, Mila. That's great. And it's a really good reminder, I will say, to me personally, because I think that the advisory group itself is very focused with an equity basis. And I appreciate sort of the reminder that I really need to think about how we're framing what we're talking about always, to address the intersectionality of the lives of so many of the youth that we work with.
I also want to add, Mila, your point, I think that's another opportunity for the data and evaluation committee to get involved in this work. And then maybe what I'm hearing from you, Mila, and I so appreciate your voice, whenever you are sharing, that this is, I think, a reminder that all of the committees and all of the advisory groups should be looking at their work through this lens, and that when we are using data points, we need to be including race and ethnicity in that data, is what I'm hearing. And our data and evaluation committee can help us with that. And yes, there are concerns for suppressed numbers because of populations that have small pockets of folks. And we also need to figure out a way to tell those people and their stories. Like, so when we have, a young Black person die, and that Black person is, like the population of identified Black folks in a particular area is very small. If we suppress that number, then we don't know about that depth and we can't inform our efforts. So we have to figure out a way to make sure that we're honoring people's confidentiality and also being able to be true to the data and the numbers, which includes race and ethnicity. So Mila, I appreciate you.
Thank you.
Yeah, thank you so much for taking the time to thoroughly go through that. I think it is important for us to be able to continue centering race, especially if we keep talking about having a strong racial equity lens. Part of it is continuing to have that intersectionality, not just with one set of groups of people in this alliance, but with everyone and everything that we do. So thank you for taking the time to discuss this.
Great. This is the last slide, and this is really what I would say, looking forward, is really this summer, a group of 17 people got together, spent the day. Partially it was that community care aspect, and partially it was, how do we draw in and engage allies, people who want to be supporting the work that we're doing and want to show up for young people. And so it's not ready yet, but we're going to be pulling together a call to action. And our hope is that eventually we actually will be able to take this out to, for example, coordinated care organizations, to local health equity committees, to people doing local work, to say, here's some tools and resources for how you and your community can stand up. And also here's some key tension points to look at. Are you tracking what's going on in your school board meetings, which have really become a key source of stress? So it's a really great group, and if you're interested in being part of that one, you are very welcome to contact.
Laura Rose's hand is raised.
Hi, Laura Rose.
Hi, I had put a comment in chat too, but as you were speaking, I think one of the things that was on my heart is the part about, students coming to school, that sense of safety. If they don't have it, they're also not in a position of readiness to learn. And I think so much of the time, like, we're looking at other pieces, risk factors, this, that, and another thing. But when we're working and talking about the youth in school, really making sure that that sense of safety, I think that's one of the core things that can be so powerful in reducing the risk of suicide. Thank you.
That's a great way to frame things. Actually, that's really helpful. Thank you, Laura Rose.
Are you doing equity too, or?
I might suggest that we hold equity for a next meeting, just because where we are time-wise.
Okay, and what about legal means?
Legal means I think we should do.
Okay.
And Jonathan was gonna help, but I was gonna do some of that one too.
The legal pieces. Okay, so let's do legal means,
And I can go fast. Okay, cool. And is it okay to folks in the room if I stay seated so I can click next? Okay, cool, thank you. So lethal means,
I just want to ask, especially given the conversation that we were just having around equity. I know that we need to be conscious of our timing, but I really think that it's an appropriate time to equity lens brought forward with the work that is happening. It doesn't mean we can't continue to grow, and to definitely take into account that we should always be using it. And I feel, and I want your voice that it's even more important that we take the time to get an update from our wellbeing plan.
I don't know what else to say. I think we should know.
Thank you.
Let's put this on our side and let's get a report out from everyone. So Jen, go ahead, do the means, and then we'll do equity.
Sweet. So our Lethal Means Committee has 3 chairs. We have Jonathan Hankins, Pam Pierce, and Kelly McWilliams. And the reason why we have the trifecta of amazingness is because we have some subject matter experts on our committee. Mila is thanking you for saying, that was Charlotte, Mila, about the equity piece. And so those are our chairs for the committee. Our committee has recently become, received that committee status. We were previously a work group, originally started off by looking at specifically the leading cause of death, which is firearms. There was some focus groups that were done to hear feedback from firearm owners around what can be helpful for suicide prevention and like what's helpful for them as a community and a population. Out of those focus groups, the Oregon Firearm Safety Coalition was formed, which Donna Marie Drucker is the I can never remember. I think she's the head honcho of that. And she was previously a committee chair due to school and stuff. Kelly is now sitting in as our firearms expert on the committee. And because Oregon Firearm Safety Coalition is now looking at firearms and they're doing a phenomenal job, we did not want to duplicate efforts. So we're partnering with them and we help them as appropriate and as they would like for the firearms piece. And then our committee has started to focus more on the 2nd and 3rd leading causes of death, overdoses and suffocation, strangulation. So those are what we're now looking at. And okay, it's cool. So our focus areas are really providing recommendations to Oregon Health Authority on those leading causes of death. And then one of our current focus areas, I know I just said that the Oregon Firearm Safety Coalition is looking at that firearms piece specifically. However, there is legislation that's going to be put forward in the short session around safe storage. And that was attempted to be passed this past session, was not passed. And so we're kind of going to break it up a little. Well, there's going to be more happening with that. Kelly, can I put you on the spot? Because Kelly can talk about it. While that's not like our focus, it's like our short-term focus area to kind of help for the short session. And Kelly McWilliams is here. She's the director of the Rural Engagement Project and firearms expert for our committee. And she will tell you a little bit about what that legislation will look like.
Is this close enough?
I think so. Yeah.
Hi, everyone. I'm Ms. Williams. I use she, they pronouns. I am the executive director of the Rural Engagement Project. And the bill that we tried to pass in the most recent legislative session was one that would have allowed temporary custody of a firearm to be transferred to another person. It's not under the Brady federal law, transfer includes giving somebody a working firearm. This would be like a temporary situation where they're given a firearm that's locked. That's then either put into storage at an FFL or given to a family member or friend. We were not able to get that bill passed in large part due to time constraints with the walkout and also trying to thread the needle of what will the NRA not oppose and gun safety advocates also support. So that's kind of a tough thing to thread. So we decided that we would continue in the interim to work with that coalition of folks to bring the bill back in a version that everyone can get on board with, really take a look at the evidence and whatnot. And so we've split that bill into 2, and one will be moving forward during the short session and one will be waiting for the next long session to build on the work that we hope to pass in the short session. We've been reminded by leadership though that the short session is only 35 days. So we're really trying to get everybody in line and have everybody understand what the outcomes will be. So we're hopeful that we'll be able to get it passed during the short session. Questions, concerns? Wasn't planning to speak, so I'm sorry.
And I'm sorry for putting you on the spot, but I appreciate it. So that's Julie, you unmuted?
Yep, sorry. Thank you. Hey, wonderful work, Kelly and committee. Kelly, what's the part that's going to come in the short session that you're pushing? Which of the parts?
So in the previous iteration of the bill, it would have done 3 things. It would have started the program for FFLs, including a funding component from OHA for the storage lockers themselves. it would have amended, excuse me if I misquote this, regulation 166.435, I believe it is, that, controls who you can give a firearm to without a background check. And that is a very limited list. It's like immediate family members, step parents, things like that. I actually am one of the people that don't have anyone that lives in Oregon that would qualify for that if I wanted to pass a firearm to somebody else in a moment of crisis. And we know that that's the case with lots of folks in the state right now. And then it also would have amended the requirements for a concealed handgun license to include a firearm prevention component, or sorry, a suicide prevention component. Most people who take the CCL course in Oregon take the Utah compliant course, so that already has that component in it. We just wanted to make it required. So that piece will not be moving forward in this iteration, and the transfers between family members amendments will not be moving forward in the short session. It's just that FFL storage locker component that will be moving forward right now. Hopefully. We'll get there now. Federally licensed firearm.
Thank you, Kelly.
May I say something about that real quickly?
Please.
This is Clyde Robertson with the Veterans Stronger Together. Our last meeting, we had a guest speaker from Clackamas NAMI. I don't know if there's any NAMI people in today on the call, but Casey Curry, and she mentioned what you were talking about just now, Kelly, with the passing over to, and she made a specific point about the confusion that is and how hard it can be. And her, I don't want to misrepresent anything that she said, but she wanted people to know at our particular meeting that it's probably going to be okay, and it's a good thing if somebody comes to you and they are at risk and they have a means of doing it with a firearm, that if they trust you with their gun, go ahead and take it.
Yeah, to speak to that, we've only been able to find 3 cases where improper transfer happened. And none of those cases, some of them did result in charges being brought against the person, but none of them resulted in.
That's what she said. Yeah.
However, all of those people were not white men. So the charges that were brought were leveled against people who we know already experienced multiple marginalization. And so one of the things that we are working on is, if you follow like the ERCO law, the red flag law, it's not being used largely because they are afraid of contact with the forces that the ERCO law requires. So what we're trying to do is say, if you have somebody in your community that you can go to and trust to do this on your behalf, we would prefer that you do safety and support somewhere, even if it's not for the police officer, rather than continuing to answer the customer and the member. And this law has actually been passed in other states. Louisiana and Utah both working on this, and several other states are trying to do very good. So we're hopeful that that movement will get there.
So to let folks know, I tried to type it in the chat, again, not as eloquent as Kelly has just said it, but basically there have only been 3 cases that they've been able to find where people were charged for passing a firearm to somebody that the current statutes like don't allow. And of those 3 cases, they were not white people, which is another reason why it would be helpful to have the legislation passed, because you know, people who are getting in trouble for this are folks who are people of color who are already like have a harder time with law enforcement than should happen. So that's another reason why we're working. And other states have passed similar legislation, Louisiana and Utah. Thank you. You guys are so helpful. So that's a little bit about that. And as we move through the session too, information will come out through our emails, our listserv emails, so that way you can stay up, or you can join our committee, you know, so there's 2 different ways that you could find out about that. We're currently working to try and have a meeting with a group of advocates who was not a fan, who had concerns had concerns with the legislation, so that way we can meet with them before the session happens. I've reached out to them. I haven't heard back just yet, but I'll reach out again. But that's kind of a little bit about that area. Mary, your hand is raised.
Yes, if someone on this committee can clarify for me, I'm embarrassed that I didn't know this. I sat in on our child fatality review, and we had a 14-year-old that died of suicide with grandpa's gun, and they were going to charge grandpa. I didn't know that it was illegal to not have your gun secured. And you can be charged for that.
I think it was 2 years ago that.
That's a recent change as of 2 years ago, Kelly said. That they changed that. It was written in 2020.
I'm sorry, I can't hear it very well.
was-
Is that for everyone, every gun, or just if there's kids in the home?
It is a secure storage law, and it was released.
It's a secure storage.
Yeah. Gun, secure storage law, so whether or not you have children in the home, it is illegal to not have it secured. But yet, I think everyone in this room knows that that is not happening. You know, yeah, so I could share similar stories, the youth that died in Travis County via gun. They all belong to the family and they all have been unsecured.
And Charlotte also said that even though the law was passed 2 years ago, that like actual rules, the orders around it haven't been written. So the law is there, but there's not like, you know, what to do and what not to do. It's just so that's funky. Thank you, Justin, for putting that in the chat.
Which again is a good example, like when Annette was talking about all the legislation that the Alliance has helped to pass. Just because legislation passes doesn't mean that it's being enforced. And this is a perfect example. The legislation has passed. There are no ORSs, or there are no revised statutes, there are no laws that help us, or statutes that help govern how the law will actually be implemented. And so there's no accountability for it, really. So
yeah.
Lots of work to do. Yeah. Any questions for Lethal Means and the amazing work that that group is doing? All right. Equity.
Can I, is it okay if I say something? So with Lethal Means 2, we've had a couple of difficulties. Like I said, we're looking at mainly, besides this current the legislation, we are looking at the second and third leading causes of death, which we have found quite difficult to create recommendations around. One is because of data challenges, especially with that overdose piece of one reason of a means of death by suicide. We just never know, like with and I guess it would be hard to tell, but kind of like with the overdoses, like, was this an intentional overdose? Was it not? And so that's something that's difficult. And then also too, with the suffocation and strangulation, that's a very difficult one to create recommendations around, because it's, I don't need to say why. I feel like we all know why that is. So those are just some difficulties. So if folks have ideas, one thing that we were thinking of previously was to try and connect with residential care, which I know homes are not residential settings. So like, we're not trying to say that, however, just to kind of like see what they do in those settings around the suffocation and strangulation piece, could be like some kind of ideas of things to recommend. Again, not at all saying that homes should ever operate as a residential center, because that's its own issues. But so that's kind of some difficulties that we're having. So that data piece in that. And Jonathan, is there anything that I missed that you want to throw out really quick?
I just want to say, yeah, thank you for representing Jen and Kelly. And I did want to say too, continuing to center equity in our work, because it comes up with Lethal Means as well. And so there were 2 bills that came forward last year in the legislative session. One, the committee chose not to support because we felt like it wasn't written with an equity lens, and we didn't feel like we could support it. But we were able to, support the other one because it was centered around suicide prevention for all and safe storage. So I don't know if that makes sense.
Mm-hmm. It does. Thank you, Jonathan.
Certainly.
So if folks want to join, that's another small but mighty work group turned advisory group turned committee. So if folks want to join, we're there. And then Annette, Michelle.
Somebody?
Yeah. For our equity, so Michelle, who has been playing a very influential part in leading our equity group, as has Annette. So thanks to both of you for your leadership.
Thank you, and if you're frantically looking for this in your handout, it's not in there, I didn't get it done till 5 a.m. this morning. That's maybe more transparency than you needed, but it's real. The Equity Advisory Group has really been in sort of an incredible group, I have to say. We've had Michelle Benjamin and Angela Perry, who are co-chairs, and Michelle's gonna talk about the equity screen that we've worked on. I'm gonna give an overview of some of the other pieces of work that we're doing. After we had that year with Uprise, they left us with some key recommendations. The first one is they said, attend to your own process, like look at how you're doing things. How are things going within your own organization? And they said, you really need to increase your transparency. And so that's why we do things like the orientation, and we're continuing to work on ways to try and, we're a big, complicated kind of structure, and we're trying to find ways for people to feel engaged and find a way for them to feel like their voice is heard and that they understand the big picture of what's happening. And so we really welcome thoughts that you have about that. The equity agreements are the group agreements that we use as a group came out of that group. And the other piece on that is we really want to be sure that we're centering equity and recommendations. And I thought we had a great example this morning of how to do that, like of taking a pause, taking a stop after that report I did on LGBTQ and saying, wait, are we really using our equity lens here? And so appreciated that happening. The second piece is really, and I feel like we are more in the beginning the beginning process of it is really being intentional about partnering with other organizations. So instead of always asking folks to come to us, find ways that we can partner and support the goals and hopes of communities that are been marginalized and of communities that have urgent issues that are related to suicide prevention, but have not maybe had the suicide lens on that. So, because one of the things we found is that lens of suicide prevention actually can convince people to support initiatives that might otherwise oppose it. Another really important piece of work has been developing our own internal kind of community of care and learning. I really call them communities of care and learning. And we have two groups. One is the BIPOC group. And I don't know, do we have any of the folks online who are part of our BIPOC group?
If you are part of the BIPOC group, would you please raise your hand? Oh, there's one. Lucas Soto is on.
Lucas. Hi, Lucas.
Thank you, Lucas.
Lucas, this is
Hey.
totally putting you on the spot, so, throw a dart at me and say no if you want to, but do you want to just say a couple words about the BIPOC group?
Yeah, I can jump in. I'm not going to turn my camera on because I look like a crazy person right now, but happy to be here. I'm traveling this week and with my son, so it's been a little bit hectic. But yeah, the BIPOC committee has been meeting for the majority of this year. Most of us are part of other committees as well. And this year, kind of the central activities that we've been focused on is supporting our colleague Iden Campbell's Suicide Prevention Summit for the Black and Native American communities. Him and I have been putting on that event. This year, I think, was the third or fourth year that we've been doing it. We started it in the height of the pandemic, and this year was the first year that we did it in Portland in person. We were at the Portland State Native American Student Success Center. And yeah, with that summit, we convene different national thought leaders and speakers that focus particularly in the Black community or in Native communities, because the conversation often leaves both of our communities out. And so that was a great success. We had a bunch, we had a huge turnout in person, and had a bunch of people tune in virtually. In addition to that, Aiden launched his coin project. It's projecttolive.org. I'll drop that in the chat. I'll put the website for the summit and the coin project. So we've really been kind of following Aiden's thought leadership and supporting the stuff that he's been doing. He's been super active in statewide suicide stuff for some time now, and nationally as well. And then I'm trying to see what else is relevant to share. It really has become more a space for folks that work in the field to just connect. A lot of the times we're just kind of hanging out and laughing and having fun. It's not always like business oriented, and I think that's really refreshing for a lot of folks. So it feels like a strong community of care in the BIPOC committee. We're always open to having more folks join. I heard that there's different people in this call that identify as Black, Indigenous, or a person of color. So if it's not something that you're a part of and want to become a part of, you can get a hold of me. I'll put my email in there. And then I think the official chairs might be Marianne Mueller and Canada, who's over at the city. So if you know them, you can also ping them. But yeah, it's been pretty cool, and we'll see what we roll out next year. But yeah.
Thank you so much, Lucas. And I just have to say, Lucas Soto has been really instrumental in working with us as well with the equity screen that we've developed, and also really in helping us think about how do we live our values as we do the work moving forward, and at the same time really hold the line around there are issues that are so important that even if it's going to make someone mad, you step in and you talk about it. But he has just a really gentle, kind of inclusive way of bringing people in. And Lucas, I just want to acknowledge your leadership in so many ways.
Side praise.
Thank you. Yeah, it's been awesome working with y'all. We did some really awesome collaborative work to get that equity screening tool out with Michelle and Annette, and then I've been working with the LGBT subcommittee too. And yeah, I love working in this community. Everybody that does suicide prevention and mental health focus work is just really refreshing to be around folks that kind of remember their humanity and are, happy to collaborate and to just share space with one another. So I've really enjoyed working with y'all as well.
And then I wanted to say a brief word about the WALK group, the White Accountability Group. Lucina, could I pull you to the front of the room? I was looking for somebody who was willing to take leadership with this group, and Lucina raised her hand and has been doing an incredible job. And I was wondering if you would say just a couple words about who we are and what we're doing.
Sure, yeah. The point of that group is for people who are white to come together and both learn about what it means to be a white person who is working to dismantle racism specifically and other forms of oppression, and then also to hold each other accountable to doing that work and to reflecting on that work and to making sure that we are, not doing harm while we try to do that work. The idea is that it is a space for people to be really vulnerable, and that it's hard work and it takes a lot of looking inward. And so our hope is to make a safe space for people who want to do that work inside themselves, and then also to be really working within the Alliance to look critically and dismantle racism and oppression, to hold ourselves accountable to actually, like we say, equity lens a lot, and sometimes we're just saying it and we don't even really know what that means. And so really looking at what that means and growing our capacity within the Alliance to say that and know what it means and have it be impactful. So you've seen it.
And I'll just say, if you're interested in any of these, you can always reach out to me and Jen also, we can help connect you up. I know there's a lot of people jumping up to track who are, and this is one of the things I'm loving seeing today is really the sense that there is shared leadership in this alliance. There's so many people who are making it happen. The third area that we really see a role for the alliance is around demystifying systems and breaking down barriers. And the primary place I believe we're working on that right now is with our small coalition grants. That group has a learning community. We'll really be working with the coalitions around how do you integrate equity, but also helping them to understand how they fit into the big picture. And then even more importantly, hearing from them about what do things really look like in your community. And some of these coalitions are geographic, regional. We also have, like Clyde here, we have a couple of coalitions that are population specific. So it's going to be an incredible resource in terms of hearing what needs and strengths and capacities are in those communities and being able to ensure that the recommendations that we provide to Oregon Health Authority are rooted really in the context of people's real lived experience. So we've had some key accomplishments. I think we've been talking about those already, but I did want to take a pause on the equity screen, which Michelle and Lucas have provided incredible leadership on. And Michelle, would you just share with folks a little bit about what that tool is and how we hope to use it?
Yeah. To build a little bit off of what Lucina said, one of the ways that we are trying to build capacity, both in the Alliance and hopefully more broadly, is by developing an equity screening tool that helps us look at ways that we're able to center our work in equity among a number of different principles that we've developed. And so this work really began back in 2021. Many of you were involved in the building of the first adult suicide intervention prevention plan for our state, and we created this equity tool to really use as a way to make sure that we're looking at our recommendations, the way we allocate resources through a really specific lens so that we are not leaving people out. For us to be able to impact suicide prevention across our state for everybody, we really do need to be centering equity in our work. And so after the YSIPP was completed, the equity committee for the Alliance really picked up this tool to figure out how can we continue to make it usable in our work. That was one of our main goals all along, was to create a really pragmatic tool that people could pick up and dive into. And so for us, we finally in, what was it, July, we're able to publish and print our equity tool for the very first time that outlines 5 different principles of equity and really is kind of a workbook that folks can dig through together that asks a lot of questions around our principles of equity, shares examples of what it might look like to center equity in those different principles, and it is really specific to suicide prevention. That was one of the things we were finding. We didn't want to reinvent the wheel by creating an equity screener, but we weren't finding anything related to suicide prevention really out there. And so that's why we kind of picked it up and did it on our own. And yes, thank you to Lucas. We really spent a lot of time and energy and sweat, no tears, thankfully, really to pull this tool together. And one of the ways that we're hoping to utilize it in the Alliance is to have folks on our equity committee go around and visit the other committees and try to help them understand how to use this tool. And as they're currently working on their next round of recommendations for the YSIPP, we want people to be running those things through an equity lens. And so we'll be helping people to utilize that tool and do some troubleshooting with it. But we also will have the opportunity to support all of those coalitions who got those small grants in trying to do the same thing. And so we really want to make sure that people feel like they have a sense of what this tool can help them accomplish, and then help them sort of troubleshoot along the way how to actually do it. I would encourage you, Jen was able to get this up on the Alliance website, so if you have an opportunity to go check it out, it has been a labor of love, and I'm just really excited for people to have some extra tools to continue to do this really, really important work.
Thank you. Thank you,
Is
Michelle.
that everything for our committee?
I think that's a good start. I mean, I can just, I'll say very briefly, some of them looking forward. We really want to strengthen the way we onboard people, especially around issues of equity. As Michelle mentioned, provided support and supporting coalitions, continued learning and community care. And then this last piece, I really want to make a personal ask to all of you, is that developing new partnerships and identifying areas for shared advocacy, I believe is a function for all of us who are part of this alliance, that really thinking about the people and organizations, you know, that are serving their communities in strong ways, have strong voices, and that may not know about the alliance, or may not be connected. We would love your help in developing those relationships, or even if you want to be a point person, to say, I would love to go to meetings of, in my community, it might be Centro de Latino. I would love to go to their meetings and support their work and report and be a link for the alliance there. So it's gonna take us a while, but I think we're gonna do some good work with it.
An alliance of alliances.
Exactly, exactly. So I believe you all have stayed here in the room for 2 hours and online for 2 hours, which I know feels even longer. So it's time for a break, right?
Yeah, so
yes, Gordon. Go ahead, Gordon.
First, sorry, I was setting up. I've got.
Gordon, will you come up here so we can capture your voice? And we can see your amazing outfit too, because it's important.
Well, it's got.
There you go. Come on up here.
Of its
Yeah.
own.
Okay, now
Okay.
say what you're gonna
Well,
say,
I mean,
'cause- okay.
Be sure.
Yep.
Okay. My name is Gordon Clay. My pronouns are ze, theirs, theirs. I am from Brookings, Oregon. I am white. I'm of the privileged class. And I am determined in my ventures. Outside, I've got a lot of materials that have been the messaging programs that I've had running down in Curry County for a number of years. Almost every one of those programs is available to anybody to use. And I've got sheets there that actually give away that you can order the coasters and order the coffee hot sleeves and all that kind of stuff. Bathroom messages to put on the back of bathroom stalls. I got like 17 of them out there. Any of those, and there's no cost involved except for you on printing and shipping. So everything, and I've got a display for tabling events, like 6-foot displays and A-frames. All of that stuff's available. A 16-page 4-color newspaper magazine insert that I did down in Curry County. Also, I've got probably 10 or 12 toolkits that we've been using down there on all different kinds of law enforcement and a whole bunch of different areas. That I've got a sheet that you can actually find those on and pick up and copy off of that. I've got a sheet on Hispanic materials that are both English and Spanish. I've got one whole board out there that are English and Spanish. And a sidelight on that, as I've just applied for a grant to reproduce our Are You OK brochure in Spanish. And I've got our Are You OK brochure in 243 locations in Curry and Del Norte County, retail locations. And I am going to, if I get that grant, and this talks to the equity situation, I'm buying a side-by-side holder, not putting two separate, side-by-side holder in there, English and Spanish. I'm taking that in to the locations. And I've got barbershops and salons and all kinds of places, dispensaries. If they will not take the double brochure, I'm pulling out the English one. And I am not going to support what is happening with the Lethal Means Committee on, if you don't have an equity lens with this, you're not gonna get the property. And then the last thing I wanna say is that yesterday, I was taking in a case of our coffee hot sleeves. Life is better with you here. I got t-shirts and all kinds of stuff. To Starbucks in Curry County. And the gals behind, they've been doing it, but they said, well, I've got to check with the manager. They sent down the HR woman and we got and there's no problem. We got them in Starbucks and about 30 other locations in Curry County and bars and restaurants, all kinds of stuff. And she said, you know, that Are You Okay brochure, and we've been using it in there. She says, I need 1,000 of those because they want every single employee to have one. And it says, what are people doing? What are they saying? What's going on in their life?
Yeah.
So I'd love to talk to you out there on the break. And thank you.
All right, so speaking of break, folks, we are gonna send you out on a 10-minute break in your virtual space or in the real space. I would ask that you please come back by 11:13. We have a really full, important stuff. This has been a very important, but we also have more important stuff. We need your brains for, and we need your votes on for voting members. So please come back at 11:13. Use the bathroom, stretch your legs, check out the stuff that Gordon brought, get some coffee, get some sun. Talk to Jill Baker about turning the heat up in this room. Yeah. 11:13, come on back.
Oh, and everybody, virtual, somebody was asking about the end time for the meeting. So the meeting is still ending at noon. We're a 9 to 12 meeting. So the breakouts are no longer going to take place. We're gonna be, we're gonna be totally shifting just the rest of the meeting. So yeah, no more breakouts. The agenda is there and it'll help us. But we'll be over at noon. Yeah. See you back at 11:13. When you start listening to the meeting, do you know, do you like mute the Zoom so like they don't hear us? Okay, cause that I wasn't sure.
All right, folks. Thanks for coming back. Okay, folks, we recognize that we once again tried to cram too many things into our agenda. I don't know if you noticed that. And which is a great problem to have, because also practicing being in person again, we want to have time for opportunities for people to mingle and chat. So we're trying to figure it out. So that being said, we have made a decision. We are not going to work.
I said thank you. You said whisper. Yeah.
Who's talking? Not gonna vote on bylaws. We're not gonna do any of that stuff today. I know you're really disappointed about that. Because the presentation that we have around the Black Youth Initiative and the Youth Suicide Intervention Prevention Plan, linking that to the work that centers equity. Jill's gonna talk about that. So we are gonna be spending the rest of the time, we will not be doing staff reports. So basically the only two things that are left on your agenda are the Black Youth Initiative report out and talking about the updates for the YSIPP or the Youth Suicide Intervention and Prevention Plan. And Jill is going to be talking about both of those things. So Jill Baker, take it away.
All right. Which one do you want first?
The Black Youth Suicide Prevention.
Thank you.
And actually, will you, and then have the infographic ready, which is an email.
How, like, just temperature check in the room. You are warm. Okay. I don't think you look like a little warmer in this room.
Oh,
I do. Yeah. I could do a little bit.
Starting with the hard-hitting topics. Okay, Gally's gonna go find a way to make Chris made the room less chilly. Yeah. For those of you who are online, adjust your temperature as needed. We are gonna swing back towards hot here. Okay, so I am presenting on the Black Youth Suicide Prevention work that is happening. And I want to acknowledge that I am a white face presenting on the topic of Black Youth Suicide Prevention. And I hope you'll see some of the leaders that are doing the work as we go. Is Sean Ely, is Sean on the?
I think so. I think so. Yeah.
And Canada Taylor Parker and James Dixon are all Alliance Connected Humans who are part of this work, who all graciously either couldn't be here or declined my invitation to co-present. So I'm just naming that. Next slide.
And there's a few rooms over.
And there, that's the other thing. James has presented on panels this week. Des, who you'll see their face, Deshawn presented at the Zero Suicide. Like, they're everywhere doing a lot of things. So that was not meant to be like a.
This has been a busy week.
Yeah, it's been a busy week. Lots of good things happening. I want to name that that this particular work is incredibly important to me, both professionally and personally. Professionally, I'm going to talk about in a second, and maybe in the second presentation around the data. And personally, because I have two daughters who are Black. Next slide. So in the next presentation, I'm going to draw kind of a bigger picture around data. This one, I wanted to highlight some specific data that we gathered as a part of the Black Youth Suicide Prevention Initiative. It's weird not to see your, in that, in trying to tell the story for Oregon, what's happening around Black youth suicide in particular. So naming that the Black youth suicide prevention work is something that Oregon and 7 other states were invited by SAMHSA to participate in, starting with SAMHSA's support. And so you'll see that work coming. A couple of important things to note that we know in Oregon. So the first 3 points on this list are Oregon specific. The last one is national. That in Oregon, when we look at our emergency department visits and hospitalizations, so those 2 data points, African-American female identified humans had the highest rate in both of those categories, even with small numbers. So to Mila's point, and it took a while to figure out what data story we could tell that was still statistically accurate, and making sure that we were trying harder. And so I just want to name that this represents a lot of really good work from our friends at Public Health, who I asked 1 billion questions to, and we worked through over and over again to be able to get these data points. So you can see that while we can't say our rate of Black youth suicide is increasing, because rate of suicide is measured 1 per 100,000 of a population, we can say that there's a disproportionate number of Black youth suicides in Oregon, which is that third point there. You can see the percentage of our total number versus the percentage of total Black youth in our state. Will you pull up the infographic real quick?
Yeah.
Because the other thing that this group, you'll see a picture of their faces here soon, but the other thing that data point that we found was we asked the question of where are Black youth in Oregon, and there are Black youth in every county in Oregon. And that was surprising to some of us, and thinking about every county, even in the real Eastern Oregon, there are Black youth, and Multnomah, of course, has the highest population of Black youth. But if you scroll down this infographic, down, that county list in the bottom right there. So this was also something that surprised me about, that's the order of Black youth population by county. So Multnomah is number 1, then Washington, then Lane, then Marion, then Clackamas. And so to lean into, we can't just have this be a Portland Metro based idea. Okay.
Question in the chat,
Yeah.
is the discharge data self-disclosure?
About race, or?
Mila, do you mean yes?
It's hospital discharge data, and so I don't know the answer, but I will find out and follow up.
Okay.
And by I mean Taylor Chambers will find the answer. Okay, back to the power. Thanks for that. Okay, next slide. This is the team that traveled to Baltimore. So SAMHSA invited Oregon through the dazzling personality of one James R. Dixon from Multnomah County, met SAMHSA rep at the American Association of Suicidology Conference in Portland in April. And that led to an Oregon-specific invitation to this policy academy, the first of its kind. So Oregon is one of the first states to attend a SAMHSA policy academy for Black youth suicide prevention in particular. This group of humans are oh no, I'm gonna get emotional. Are my friends. They're humans who are doing excellent work around the state. They represent people from Lynn County, Marion County, Polk County, and Multnomah County metro area. They represent a faith leader, educator, therapist, college student, community-based organizations, and of course, county leaders. The reason they were the travel team to Baltimore is because we had about 3 weeks to identify a travel team to Baltimore. And so one thing that has been kind of a chicken egg situation in this project is how do we get the right people at the table for Black youth suicide prevention, leaders and representing all of the different areas of the diaspora, and also geographic around the state, all the things. So there's work to be done. Next slide. I just talked about this. It was a 3-day policy academy in Baltimore. The room was full of Black leaders and experts and people from different states doing good work. The Oregon team left that 3-day experience with the intention of launching a Black youth suicide prevention coalition who will be applying to a mini grant that you may have heard about earlier. And that, right now, so, we went in July, we've been meeting every 2 weeks since. Some work groups have been meeting on the off week also to try to set the table for that to go well. And so much more to come is the non-satisfactory answer about how can I be involved.
Did I go too soon?
Nope, the group is working on a suggestion for a foundational charter, knowing that that will change as the group is actually established, working on group values and group agreements, trying to create a space that will be safe to invite folks into. And in particular, the group is planning a town hall event that will be hybrid, in person, likely in the metro area, and then virtual for this fall to, and I hope to see all of your faces at that, as well as the invite list for lots of Black leaders around the state and people doing the work of Black youth wellness. That is one piece. The other piece is that OHA has entered into a contract, trying to enter into a contract. I'm putting it Karen Solaris because I think there might be an email in your email inbox where we need your help to finish that contract. With Portland State University to do a project called the Life Sustaining Practices Pilot. Dr. Kendris Watson was a speaker, incredibly powerful speaker at the Oregon Suicide Prevention Conference last year. He and his research partner, Dr. Tiffany Marie, along with a researcher from Portland State, Dr. Shante Stewart-McQueen, are leaning into this fellowship program to lean into the life-sustaining practices that Ken just talked about at the conference around connection to culture and consciousness, rooted in ancestral wisdom to be able to have healing for Black youth. And we think that that will show up in surveys and also in telomeres. And if you don't know what telomeres are, Google Dr. Kendris Watson.
There is a data question. Do we know the gender makeup of the Black youth suicide deaths? So identified as, the question says female, male, and other genders.
We do know that. That is not in that information, but I think we can find it. Yeah.
She looked at Taylor and Taylor nodded and wrote it down. That will be coming.
This is an incredibly exciting project, and we're hoping that the Black Youth Suicide Prevention Coalition will, and this project will knit together. It's not meant to be two separate things. Right now, they're two separate things, but we're working on knitting. And what this means is that 30 adults working with Black youth, increasing Black youth wellness, will receive amazing mentorship from excellent Black leaders to create interventions and ideas for Black youth wellness, which we will have a strong research component on and further the field. It's just so exciting, I can't even handle it. And if you don't know these other OHA humans, you should, because they're also excellent. Next slide. Question.
Yeah, I just wanted to say something about James Dixon because this is just a little interesting tidbit bit. I was there when James met the Brandon from SAMHSA, and Brandon's, and you can give us an update on this, but he said that James's official title is the Black Youth Suicide Prevention Coordinator for Multnomah County. And Brandon said that he is the only Black youth suicide prevention coordinator in the United States that he was aware of, which is one reason why Oregon got invited to this thing. So it's pretty exciting. Yeah.
There's another data question.
Yeah.
Taylor.
I also have an update on the last data question.
Oh.
2 data questions ago.
Well, then do you want to give your update first? Because it actually isn't a question, it was a statement. I just assumed it was a question. Cool, thank you.
Okay, so, sorry, I have my phone because I texted our epidemiologist who has this information more readily available than I do. So in terms of race ethnicity being self-reported, this is what they said. So hospitals have been asked to follow OHA guidelines asking. So hospitals asking for race and ethnicity. And in terms of what those guidelines are, I can get that information too. But it's not always the case though, as some people may be unconscious, lack of standards followed. And part of what the work we're working on now is with real D data. And so the other thing that Dagan mentions, our epidemiologist that I asked, is even if asked, we only see one race or other race, though no multi-race or write-ins currently. We only see the OMB national categories, but hope to have real D in future. So more coming, but right now it's self-reported based on how the hospital asks the person, if that makes sense. Okay, and you can ask me my follow-up.
No, I was incorrect. It was a statement that I just assumed was a question. But the statement was, what we know is that African-American males are much more likely to die by suicide, was the statement. And Mila says, yes, thank you for gathering that information. She says, no problem.
Just give a shout. Taking a break from the space. I also want to just give a shout out to folks like Taylor in our OHA with our OHA team, who better understands the data than a lot of us. And Oregon State is the state of Oregon is very, very lucky to have the access to data that we do, and the team of folks like Taylor and the EPI that she just mentioned. Like, not all states have that, those resources. So I just want to say thank you for what you do. Thank you to what your team does, because it makes our work more data informed. Thank you.
Okay, so the things that you should be watching for this fall around Black youth suicide prevention, watch for the town hall invitation. Email me if you want to be on the list, or make sure I'm checking that you are on the list for distribution. Although it will go out via Jen, the Alliance listserv, and it will also go out via Megan Crane's youth suicide prevention listserv. So be watching for it. And then if you have a Black leader in your area who's doing excellent work with youth in your area, or someone who's predominantly working with Black youth in your area, that you think, ooh, I want them to be a fellow and soak in the wisdom of those 3 amazing Black researchers, email me that, please. Taylor Chambers.
I just, on Dr. Watson's, on telomeres, if you wanted to learn more about that, in the 2022 Oregon Suicide Prevention Conference, he gave a keynote speech on it, and you can watch that. So it's recorded, it's online, Oregon Suicide Prevention Conference. You can Google that and you'll find it, and you can watch that, and it's great.
You can also Google if these cells could talk. That's the.
If These Cells Could Talk is the name of the video that kind of synthesizes the work that they've done so far. Any questions around the Black Youth Suicide Prevention Initiative? Yeah.
How can the Alliance better support this work?
So I want to be super transparent in saying I asked early on about whether or not they wanted to be a committee of the Alliance or a work group or that type of thing, or how we could knit together the statewide structure. And they very wisely and bravely said, we'll ask some questions of the Alliance and check and see kind of where that is. And it's really important that it's not an OHA group. And since the Alliance is both staff funded through the OHA and advises OHA, I think there will be moments to be good partners. Yeah. Any other questions around this? Okay.
I will pull up the next PowerPoint.
We're gonna get in our remaining
26
time together, I wanted to ask us to practice using the equity screening questions. I pulled a few around a couple of specific YSIPP initiatives that I know will be ongoing into 2024. So as a reminder, I'm gonna skip a bunch of these slides so you can go.
Okay, you could share so they can see the madness of the skipping. And then go back over here and then do.
Oh, no,
Oh, no.
no, just kidding. One more back. Yep. If you might remember, we are doing annual updates of the YSIPP initiatives. We're asking, what do we want to start, stop, and continue? So it's meant to be a chiropractic adjustment, not a throw everything we've done and created a brand new list of 157 new things. But to annually take a breath and say, what are we doing? What is done? What's the next right step? And our data, our most recent finalized data from 2021 tells a really important mandate for all of us around race and ethnicity that I'm asking you all in your committees. So the next 2 months, Annette and Jen are going to come to your committees and say, what do we want to start, stop, and continue into 2024? And I'm asking you to hold tightly and center the race and ethnicity mandate that we hold. And so to keep each other accountable, to center back on how are we going to do better for kids of color in our state. And because there's lots of things that you all are working on, but I want to name that we have equity in the center of our framework. And I think it's time that we've been naming all the things that the next right step that we've been doing, but I think it's time to center it in a way that will show up in our initiatives in 2024. And here's why. Next slide. Next slide.
Oh.
You all have heard this probably 72 times, that Oregon's youth suicide rate is above the national average. It has been for a really, really long time. 2018 was our worst year for youth suicide in our state's history. We've had a reduction in youth suicide in 2019, 2020, and 2021. That's not true in the rest of the nation. So we're doing something right, and that needs to be celebrated. And we're hoping that we can lean into something we're hoping we can lean into. Two things can be true. Two stories can be told by a set of data. Lots of stories can be told by a set of data, but we're asking for you to hold two things are true. Something that we're doing is different than other states in our nation, that we are experiencing success in decreasing youth suicide in our state. And next slide. Next slide. And that decrease is, this chart shows that decrease in a really clear and concise way that you can see on the non-Hispanic white youth fatality line. In 2018, our very worst year ever for youth suicide, 95 white identified youth died by suicide. In 2021, 59 youth died in that race and ethnicity category, which is flawed. The race data is rooted in a system that has lots of flaws, but you can see it there. If you add up all of the other race and ethnicity categories in 2018, the number is 31. If you add up all of the race and ethnicity categories in 2021, the number is 31. We have a mandate. I just want us to hear it and feel it. That what we are doing matters and is making a difference is so incredibly hopeful, but it's not equitable. Yeah. Next slide. Just as a reminder, and I think was just exemplified in real time, we could do anything we wanted to do. We cannot do everything. And so as the Alliance committees and work groups grow and decide what's the next right step, I want us to hold that mandate in the forefront of our minds as we pick what's the next right step for 2024. That if there's a moment where we're like, we could do that, we could do anything, but we can't do everything, let's center our mandate. Next slide. Next slide. Okay, so next slide. So this is what we're gonna do. I have picked 4 YSIPP initiatives to practice on. And so I feel really good about myself because one is extreme risk and protective orders. One is Addie's Act. One is around the Big River initiatives in general. And one is around the suicide risk assessment and safety planning toolkit for schools. So those are the 4 options for this activity. And so I drew from, so Michelle and Lucas mentioned the equity screener priority 2. What are the principle 2 talks about a community's assets or strengths, and that oftentimes when we're doing this work, there's this deficit or problem or risk focus. And principle 2 talks about like how are we leaning into a specific culturally specific of a community's strengths and assets in the work that we're doing. So naming that's where I am in this toolkit and asking us to go for this particular activity. So your small groups are going to ask yourselves 3 questions. People in the room are going to do this on these pieces of paper. Can I use those?
Absolutely.
Great. I'm going to use these pieces of paper, and Shanda has some sticky notes. People online are going to use a Jamboard and breakout rooms. But what you're going to do is you're going to choose one of the 4 initiatives. I think we can go to the next slide. I think I have them listed. Here are the actual initiatives that show up in the YSIPP. And I tried to bold the theme. So one's Big River, one's ERPOs, one's Addie's Act, and one's the toolkit. And so I would love for you to go to an area that your heart is drawn to, asking these questions, and or who doesn't have anyone else on it. And ask ourselves, can you go to the previous slide? I'm so sorry, Jen.
If I can get my
You're a magician. These 3 questions. As we read this initiative, what communities, what humans benefits from this initiative, and what and maybe potentially burdened by this initiative. So asking ourselves that question first. Second, what is the data telling us? And so naming that this might be like, we need more data. I'm guessing that will be a lot of the answers there. But death data is one measure of how we're doing with suicide prevention. But that in my head, like I showed you what data I want you to center on in the. Don't look at that, Joe. Don't look. Oh, sorry. It'll come back. Everything's fine. And then the third question is what assets or strengths, community, culturally specific, things like a collective lifestyle instead of an individualistic lifestyle might be an example of like what are culturally specific strengths or assets that we might infuse into that, into our strategy for how to enter into 2024 with our mandate at the front of our brains. Okay. Does that make sense?
Yeah.
Great.
But there is a question.
Yeah.
It is a data related question though, so would you like to save it for after the activity?
Yeah, let's do the activity.
Okay.
So online breakout rooms will open as soon as the magician has made them so. In the room, I wonder if somebody could raise your hand if your heart wants to address Big River.
And then for folks on virtual, I did put the Jamboard link into the chat. Please, before you go into your room, just open that because it's just easier for me that way. So please do that. And then also I put the questions in the chat so that way you have easy access to that. If you also could want to copy those, that would be sweet. And I'm going to open the rooms now, but please take those things before going into the rooms, and I'll stay here if y'all have questions, and I'm going to stop sharing so that way you can do your thing. Okay, go ahead.
We have 5 minutes remaining, and so if you could practice economy of words, if there's like a golden nugget that came from your group's discussion that you can say in less than 30 seconds, would you please raise your hand in the room or online? I really want to hear a couple. So I'm not setting us up not to hear. I'm setting us up to do this in a way that we can hear lots. Tim.
Yeah, and feel free to jump in, but I think the main who benefited piece from the Big River, that was our topic area. We talked a little bit about how there are a lot of communities who don't have a lot of infrastructure. And so it's great when those communities have infrastructure, but when they don't, it's hard to provide them with this stepped approach of like meeting them where they're at and providing this wide array of trainings. Trying to think of other pieces. There's a lot of data missing in terms of intersectionality and pieces, especially with the trainings that are national. And so how do we like provide that support as a coalition or a state or whatever?
Good, thank you.
Yeah.
Next, an economy of words in 30 seconds or less. Another group have a nugget online or in the room. If they want to elevate.
I can report out on ERPO.
If you do it over here, you can, yeah.
So really, I'll just give you one nugget. So we recognize with ERPO that ERPO burden isn't the right word necessarily, but it definitely, people of color are not going to be perhaps readily eager to pursue an ERPO for people in their life, for lots of really good reasons that we know. And so that may be a reason why people don't use ERPO.
Thank you. And can we have one from online? Anybody raising their hand?
Not yet. Oh, nope.
For the toolkit, we talked about for screening, universal screening in schools, that might have a benefit around the racial equity mandate that we hold, in that around stigma, around talking about mental health in some communities of color, and that it could also unintentionally burden communities of color, in that right now our crisis system is often linked to 911 and law enforcement. And so elevating crisis risk in could have unintentional consequences as well.
Rachel Howard has her hand raised.
Rachel Howard.
I'm just going to say very briefly, my poor group, I hijacked the conversation in our group because I found the data regarding our Hispanic populations very disturbing. And so the conversation was around continuing to elevate that population's voice in these trainings and these conversations, and also in looking at barriers to providers, people who want to be providers, being able to access the education so that they can be trained in all of these trainings, because they sit in those spaces in our schools and in our government and in our provider loops.
Thank you, Rachel. Okay, hear me. That was not enough time, but that is the sort but I'm asking us as in our committees in the next 2 months, as we pick what's the next right step, that we force ourselves, like we remind ourselves and keep each other accountable to center race and ethnicity in those conversations, and to ask, what about race?
And even using these questions, these questions right here are great questions to do exactly what Jill's asking us to do.
If you are in the room, you need to sign this before you leave. If you're online, you need to put your name and credentials in the chat. Heaps of gratitude to you all. I really like you.
I just want to say, I want to recognize that there are people in the room here and people in the room here and people virtually, that since we didn't have a chance to vote on executive positions today, there are people in the room virtually. I'm recognizing that we did not vote on being able to secure your place in the executive committee today, so I apologize. We will do that at our next quarterly meeting. So thank you for your grace and patience with us. And the rest of you, thank you for being here today in Bend. Thank you for being virtually with us. We recognize this is a huge chunk out of your time, but we also recognize that without you all, the collective you all, we cannot do this work. And so we need to do this work together. We need to stay in communication. And last of all, we need to make sure to take care of one another and support each other's work. So go forth and do good, amazing work. Thank you for all that you do today and all the days, and we will see you next quarter. Thank you.